payment is for Zoom. So I use the Zoom webinar platform. I think it's about
Okay.
300 to 400 per year. Then I love streaming to multiple platforms, which I do on LinkedIn, on YouTube. And the thing is, with multiple platforms, Zoom provides only streaming to one platform. So with Zoom, you need to decide to go, for example, with YouTube or with Facebook, and that's it. And it took me a while to find a solution to stream to more destinations. And I found it with the website is called restream.io. And restream.io offers streaming to 2 channels for free. And this was my starting point, I think, a month ago, where I said, okay, this seems to be a viable solution for the problem. How can I stream to more platforms at the same time to reach more people? And I decided to give it a try. The results are pretty mesmerizing, in my opinion. Before on YouTube, I mean, my channel basically is a business-to-business channel. And the content I provide is for a very niche audience, very, very narrow and small audience. Everybody interested in drug development, in medical devices, in digital health solutions might be in the target audience and might benefit from the content, but it's not a customer channel. So when I stream to YouTube and I distribute it on the newsletter, I get some traction, but basically YouTube, I think the average age on YouTube is still between 18 to 25. And it's young people, young population. So it's good for Twitch, for example, the Twitch community, when you stream B2C content, but not for B2B. And I never figured out how to stream to YouTube at the same time, to just save the content. YouTube has its upsides. It goes directly to Google search. And I never figured out, it took me really a long time to figure out how can you also stream to LinkedIn at the same time and to Facebook on the same time, and the channels where more of a B2B community is, and Restream offers that solutions. I don't get a payment from YouTube. I don't get a payment from Restream. So this is not a commercial. The only thing is that when you want to stream to more channels, on Restream, you need to put a few bucks behind. I think the plans they have to start with $29 or something.
Yeah,
and it works well. So I'm really happy, especially the reception on LinkedIn is extremely well. So the streams in average get about 600 viewers at this point on my channels, and about 1,000 minutes watch time, which really means people are watching it on LinkedIn. And when we can help to bring valuable information about interesting startups or investors, investment processes, novel technology, breakthrough technology to more people, I think it will benefit the entire ecosystem globally.
Cool.
So I think while speaking, I have pushed all the recording buttons. I mean, this is the only downside when you go streaming. You need to start a webinar on Zoom. You need to push recording on the computer for the post-production. You need to push connecting to live streams and then starting on Restream.io. So a lot of clicks, and it makes it a little bit complicated. So this was a nice opening. It has nothing to do with the episode.
Yeah, sorry.
No, it's
yeah, because I was just, it's interesting because I've never seen anything like, live stream on LinkedIn. So maybe it's something new, or I just wasn't watching.
I mean, in general, my perception of the position of LinkedIn before 2020 was it's like an address book. When you meet people in somewhere at a conference in real life, or like we met at Health Hub Vienna, for example, here in Vienna, it's a nice tool to stay connected. When I forget your telephone number, for example, or your email address, I have a high chance of reaching people via LinkedIn. So I just enter your company name, Datlowe, or your name, get then your profile, and can then send you a message. And people were very responsive on LinkedIn.
Right.
But beyond that, before 2020, I don't think LinkedIn served any other purpose or had any other use cases. And posting on LinkedIn, like content or insight or information, I mean, when nobody uses the platform for reading and watching, it's useless to put time and effort behind marketing on LinkedIn. This changed with the pandemic and in an incredible speed. So there are the content marketing strategies, for example, like people like Gary Vaynerchuk, who are advocating for more than 1 decade now. He started in 2006 with his channels, that posting on social media helps your business. It worked absolutely fine in a B2C environment. So gaming industry, entertainment industry, wine industry, food and beverage industry, everybody who sold something, sold products of which were relatively low priced to a consumer audience could use social media for marketing purposes and for sales. Not so much in the B2B world, because the decision makers were simply not there. And in my opinion, this changed with the pandemic. So now all decision makers are on LinkedIn. The lockdowns and the shutdowns and the elimination of real life conferences for about 3 years now put pressure on the community to move, to find new solutions, and LinkedIn provides this solution. So you can not only connect to people now, people use LinkedIn to exchange information. They use it in the same way like the B2C world. And also when posting videos or live streaming on LinkedIn, people watch it. And we can help to connect the speakers with the audience on LinkedIn. And from what I know from the dynamics in the podcast and the recording, something's happening always after the recording. It's not a tool. It's not a fast turning tool. I mean, it's always in sales. It's not that you post one video and you get hundreds of calls from investors the next day and everybody is desperate to invest in your company. It's more a slow moving process. So you keep posting, you keep posting more information, you keep live streaming more, and the more you stream, the more you post, the more it resonates with the LinkedIn community. And then you see after a couple of weeks and months, you see an uptake in outreaches. Did they answer all questions that you didn't ask?
Yeah. Cool.
Jakub, how are you doing? How is life in Prague?
Life in Prague is great, as it always has been, probably.
Oh yeah, that's true.
Yeah, it's finally slightly warmer than beginning of September, so it's getting better now again here.
We get a great fall. How is the life in Prague? Are tourists back, or is it empty? I mean, I remember Prague before 2020 as a very lively town with a lot of people in the city center. How is it these days?
I think, like tourists returned, but not at the scale it was before the pandemic. I think because the Chinese tourists and Eastern Asian tourists are not really back, I would say. Because of the restrictions in Asia still, and then you see like there were also a lot of Russian tourists. They are not here anymore. So I think that there's quite a lot of tourists again, but not that much as before the pandemic.
So it's the best time for Europeans and North Americans if they want to see Prague, to experience the city.
Yeah, I think it's better than that it used to be. Which is great, because it was really overcrowded. I think in the very center, it was like the most famous bridge, the Charles Bridge. It was hard to cross even when walking. So now it's
except
for
4 o'clock in the morning. So
exactly.
For runners. But during the day, I think after 7 a.m. it was just impossible.
Exactly.
Jakub, you run let's talk about your company and you. You run a company in Prague. Can you give us a little bit insights about your background and the background of your company?
Sure. So I graduated in mathematics and then moved into computer science and did the Charles University. I worked with both in both business consulting and data analysis before starting Datlowe. I did projects in healthcare data analysis when pursuing my PhD, which I did not finish because of the company basically. And yeah,
it's
then
like, isn't it like Bill Gates and Steve Jobs?
I don't know. They haven't even finished the master studies, I think. So
Oh, really?
I don't know. So I ended up with master's degree, but not with the PhD. And yeah, so we started Datlowe, which is the name of the company, and it was focused on analysis of unstructured data, basically. We worked with different industries until we ended up focusing 100% on healthcare since 2017 when we started the first project POC.
Is there a special meaning behind the name of your company?
There was a meaning in Czech. Datlowe means woodpeckers, basically. So it meant like, you know, packing the information, picking up the information from unstructured texts, and it was kind of a like data extraction, annotation, transformation. So we played with the letters and then created this funny word, which is totally unknown to any foreigner, but it meant that we're picking the information out of unstructured data.
I mean, when I hear picking unstructured data from various sources, the first thought in my mind that pops up when I think in the direction of use cases and who might benefit from it is cybersecurity, security, the internet, big organizations, everything around security. What attracted you to healthcare?
Yeah, great question. You know, there's a lot of people working with data in cybersecurity, in the customer acquisition, customer churn, retention, and whatever, selling more, having more customers, etc. So we also try to work with banks and insurance companies. But as I already said during the studies, I worked with the University Hospital here in Prague, and it fascinated me how rich the data in healthcare is. It's really so, it has a great variety, and it's very complex. And I always wanted to start working with the data properly. So we built some projects on data integration in healthcare and so on. But in 2013, it seemed like not really viable model to starting a company in Czech Republic on working with data in healthcare, because it's such a conservative environment.
I think you are not alone in the Czech Republic. I think it's the same everywhere in the world.
Yeah, so we ended up with working with banks and insurance companies, but it was about selling more credit cards and you know, increasing fees. And I don't think there is a like great purpose in doing this business. I think like banks are totally necessary part of the society. We must have banks, etc. But helping them like sell you more mortgages and selling more, you know, loans is nothing that I would think is the best way how to spend my life with. So so helping hospitals or physicians to improve the care and saving, you know, patients from being too long in hospitals or being more healthy is way better. And seeing the people in hospitals reaching back to us and saying like, you really helped us in improving the care, is something that the whole team is really happy about. So that's probably the story. Like it's really interesting and also like fulfilling thing to work in healthcare.
That's an excellent attitude that you bring to the table. I think there's a lot of benefit in artificial intelligence and data analytics in healthcare. How was the pandemic for you in the last 3 years? I mean, I started this episode with talking about how it benefited podcast formats, how now streaming works. Did you also realize in your industry a shift in attitude from, you called it a very conservative environment, towards a more progressive environment when we talk about digital solutions?
Mm-hmm. I think like the pandemic helped healthcare in general to be aware of the power of data and digital solutions. Definitely. I think it helped them to realize like collecting data and sharing this with others is absolutely necessary to manage complex situations like pandemic is. Mm-hmm. So this is something that really helped, and also in I think the telehealth, telemedicine benefited the most. Like this is something. So communication with patients and distant care is something that that benefited a lot for us as a startup offering solutions to hospitals. It was not that easy time period because the hospitals really focused on managing the pandemic and not really bringing some innovation to hospitals, and were really busy in managing the stuff. So for us, it was like a two-sided thing. So one thing is like it helped the healthcare professionals to realize that there is a power in digitization and data, but also it kind of postponed our activities and created some lag between what we wanted to achieve and where we wanted to be.
That's good news that also you realized a little bit of a push more towards the digital worlds.
Yeah, and like for us, we're working in infection prevention. Our main solution right now is aimed on epidemiologists and hospital hygiene staff, and they also got more power since the pandemic, because before pandemic, nobody sometimes even realized they have this kind of department. But when they help the hospitals to go through this crisis, now they have like a more space to innovate and bring some new stuff into hospitals, and people realize that infectious diseases is something that we should be concerned about. So that's also a good thing.
Absolutely, I couldn't agree more. Containing, or let's say reducing the spread of infectious diseases definitely helps communities, especially in big cities, to stay more healthy and more productive and more lively than with, let's say, larger spreads. You talked about data analytics, that your solution is in data analytics. What potential do you see in the healthcare industry for data analytics?
In one word, huge. Is like hospitals and the whole healthcare system generate a tremendous amounts of data. Like all of the industries basically generate a lot of data, but in healthcare, I think people generate, or physicians, healthcare professionals, and also sensors and machines generate a lot of data that's being saved or typed into systems, but not used very much after that. For a medium-sized hospital, they create hundreds of thousands of pages text per year, which is just stored, and sometimes the people don't even know why they are doing it, except the legal purposes, because they have to do it. They have to document everything because they don't want to be sued for not following the law. But then it only lies in the systems or on paper somewhere, and nobody uses it. But the potential in healthcare data, in unlocking the data that's hidden in the systems, is really great for, I would say, for any activity that's being done right now in the hospital. Can be either confirmed by the data that it's done properly, or could be, said that there is room for improvement in these activities based on any type of analysis, and it can move the whole healthcare system forward with when using it. So like, I don't know if I should say like there's like in diagnostics there could be improvement in medication, in just simple scheduling of patients in hospitals and operating theaters, etc., could be improved by like a big data analysis based on the patterns from past and looking more into the future.
I was just thinking when I was speaking about using the untapped potential of data in hospitals. I mean, when I think you mentioned diagnostics, I love running, and in 2012 or 11 or 10, let's say when I started running, when I put more emphasis on running, there were no devices to take any measurements. So these devices that existed, I think Polar was one of the few companies who provided a belt.
Yes.
Was not very convenient. Now we have, for example, I don't have it here. Here is it. Let's refresh it. The Apple Watch, which basically does a 24/7 readout of my heart rate. And 10 years ago or 12 years ago, nobody monitored that. What I would be interested in, for example, is using the data. I mean, the Apple Watch isn't doing much. It's not telling me if there is a problem with my heart or if I develop an illness. And when I think in terms of use cases, for me, it's obvious that doctors could use this information, or companies like yours could provide such solutions for use cases like diagnostics. What other use cases, to make the episode more relatable, what other use cases do you see that you can create with data analytics?
And you mean for like the patients or
hospitals, just general, what just a little bit of brainstorming so that people get a more colorful picture about data analytics and the potential of data analytics.
I think like the patient diagnostics or something is like a most straightforward thing you can think of. Like anybody can imagine, like the watch can send a signal when something's going like wrong, but you also have to add like the other thing that it might generate also a lot of false positive signals. So I don't know, you just put it under the water or something, and the sensor gets, I don't know, broken or whatever. You put it on the straight sunlight, and it also got bad. So there's always a risk of getting wrong data out of the system. I would say just this thing is one thing, like on the level of one patient is diagnostics, or there could be also prevention, of course. A lot of startups, a lot of companies invest in creating software solutions or belts or whatever for preventive stuff, like helping you manage chronic conditions or being not eating wrong stuff, eating healthy food, etc. And this is something. Another thing, you can also create something for population health based on all data from all patients. You can imagine, like what's happening with the whole population on the level. If you get the right sample, of course, because people who buy Apple Watch, there is a bias in selection of the sample. Not everybody buys Apple Watch. You have to get the money for that, and you have to have this mindset for buying it. So there's another thing you can do. You can track if the population is getting healthier or not that healthy, or what are the problems, how much they exercise, for example, etc. If you can do something about it, this could be also for like the local communities of practitioners, etc. And then there are hospitals, of course. They are like a huge ecosystems for taking care of patients, and with a lot of processes that could be definitely optimized. And this is something that we do. Basically, we use clinical data that are generated in hospitals and transform it into some useful information that they can use for some preventive measures. So, for example, we try to detect situations when there is an outbreak of infectious diseases in the hospital and help them to track backwards what happened, where the patients were, and what might be the root causes of this happen, so that they can create in the future preventive measures that would help them to avoid these kinds of situations. Or you can do the analysis of unstructured texts to, for example, create models for readmission. So everybody or all hospitals in the world want to avoid readmission of patients. So if once they discharge the patient, they want to be as much sure as possible that they will stay out of the hospital, because otherwise it would be very costly for them. So there are also like ways of analyzing the data of the patients who were readmitted and what happened, and helping hospitals, for example, to set up again measures on how to avoid these things. Maybe rather keeping the patients a couple hours longer, or doing special types of tests before you release them when they have special conditions, so there you are absolutely sure that they will not come back to the hospital, and you don't have to, I don't know, do another surgery, for example, etc. So I think there is like a million use cases that you can think of, and I was rather thinking about the more clinical ways, but there are also like operational stuff on on how to improve processes, etc.
Fantastic points. Thanks for sharing. The question that I ask myself is, I mean, when the use cases are so obvious, why don't we have them already implemented in the healthcare system? Which leads me to the next question. What are the barriers to a more extensive implementation of digital technologies in healthcare that you perceive with your work?
Yeah, so I think, as you already said, like the pandemic helped open the eyes to the healthcare professionals a lot. The other thing is, like, we can see this from the point of IT specialists, or I don't know, that we look at the situation in hospitals from a totally different point of view than the staff that is there. They're not there to think about how they can leverage the potential of data in information systems. They try to take care of patients as best as they can with the resources they have, and usually they don't have that much resources in IT, at least from my experience. So it is really hard for them to imagine what really IT or data analysis, or whatever, however we call it, statistics, can bring them. And this is something that we're trying to change, basically, with the solutions that we have, because we always say how the solution works. So how it gets data from information system, how it transforms it into information. And then when the physicians see it, they usually say, okay, this looks interesting. We might use it also for this and this and that. And we say, yeah, that's a great idea, that we really could work on these ideas and help you also with these areas of your work. But before that, it's really not that easy for them to imagine what it, like, data analytics and IT can do, because they were not trained in any of these disciplines. So this is something that is, I would say, that they like shift in thinking needed, and in the whole healthcare setting, saying like IT and like the IT infrastructure is your core business, basically, because you have everything sent through cables and everything on your hard drives, and using computers like over the past 30 years. So banks realize that IT is their core business. They have a huge department taking care of IT data analysis, etc. But I think like healthcare is slightly behind other industries in this thing. So this is like one thing, like what about the mindset in healthcare. The other thing is also regulation, I'd say. So the barriers for data analysis in hospitals and in healthcare in general, data protection, because health information is like the most sensitive thing you have probably about yourself, and you don't want anyone to steal it or, you know, use it in a wrong way. So there is a lot of regulation put in data protection and so on. So it's very complicated to get to real life data and to implementing a solution in this. So it also holds the innovation back. So, you know, so maybe we should think on how to improve this. I think like there is this initiative, health data space, or I don't know if I'm saying it right now, from the European Union. They're aim on sharing more data that would be accessible for research and development, both for universities or research institutions and commercial institutions, and they could do the innovation. You know, I'm not so this is something also that holds back the healthcare, and I'm not saying it's wrong, because you have to somehow protect the data. So we don't want to definitely end up like China when there is like no data protection, basically. But we should think of balancing this when, for example, the legislation in Czech Republic is also lagging really behind the innovation a lot. You know, that they haven't thought about we will be doing stuff that we're doing now. So the law is really old and being prepared. It was prepared even before that. So there are the things, like, I would say, are the most blocking things for innovation. So something about the mindset, being conservative, and so on, and also the data protection and then legislation that's around.
I mean, for the mindset, and I think also for regulation, what you said, maybe a solution might be bringing the right people together and more efficiently. It's you described the example that when you talk with physicians, they immediately come up with further ideas, so that they immediately see, okay, I mean, when we can do this, we can change something in that area and in this area and in that area. But you mentioned before you speak to them, they don't know it because nobody explains it to them.
Yeah, exactly. Yeah, so it's a long-lasting process. So, you know, like, you talk to someone, they forget, you talk to them again, and then, you know, they talk to some executives, and then they talk to somebody from the public offices and so on. So it takes time. But I think,
how long is the time that it takes, in your opinion, when you start talking to hospitals?
So I think we started with whatever. I did the project at the university in 2012, I think. And back then they couldn't even imagine what they would do with the data. And so it's always really important, like when we talk about helping hospitals with data analytics, not only generate more data by, for example, if you take clinical note that the physician typed and extract the information about diagnoses and symptoms, and you put it into another table for further analysis and tell them, like, here, you got more data to play with. They would say, like, okay, but we weren't able to analyze the previous data. So how do you think we will work with this larger amount of data? So it's always important to create some information that they can directly use for I don't know, decision support or improvement right away, not only like generate more data for them. And how long it takes, I think it takes years to be like this pioneer or somebody who explains what they can do with the data, that it's even possible to work with unstructured data. Because I've seen a lot of people that they think once the information is hidden in text, it's impossible to extract data. It's too complicated. But the technology has matured a lot since I don't know, in the past 10 years or something. So now it's really possible to do a lot of stuff that were not previously possible. Like 2005, I wouldn't say it would be possible to do the stuff like what people are doing now with all the machine learning, AI, and so on.
Yeah, a lot has developed. I completely agree with that. When I think about the future in healthcare, I always love tapping into science fiction. It's Star Trek, for example, in the series where an artificial intelligence replaces the human physician in a way that the artificial intelligence comes up with a diagnosis, with recommendations of potential solutions, and then hands over to the human physician. In your opinion, is this a feasible future near term, or are we far away from something? I mean, behind artificial intelligence, there is always data. So it must always be structured data in a structured system that can be analyzed. Is it feasible, such a vision, in our lifetime?
I think like a partial augmentation of physicians is already happening right now. I think there's a lot of solutions that help the physicians to diagnose better or quicker or with like a broader perspective, because it's, even though I value the physicians highly of their skills and so on, you cannot remember or know all the hundreds of thousands of cases of the particular diagnosis in the whole world, or millions of cases. So it's always beneficial to know the different approaches that you can use. So I think this is something like helping the physicians is in my opinion the right way, and it's already happening with a lot of solutions, even like the symptom checkers in Great Britain, for example, or I know the colleagues from Poland who developed a great symptom checker. There are tools for helping radiologists in being better in reading the images, and also like other solutions. So I think it's already happening. So it's not really something that would be like hundreds of years away. I don't think that it's possible to replace the physicians in the near future, and I don't know if it's even possible in the long future.
I mean, my personal opinion, sorry to interrupt you, but I don't think so. I mean, at the end of the day, I want to speak with humans. So at the end of the day,
exactly.
As you say, support, yes, but replacement, no.
Yes, exactly. I think you're putting it right. You can outsource the parts of the work or of the job to computers or machines, because it's something that they can do better maybe, or at the same level, but not the communication thing and not the psychological thing. It's the same what we say in this when we talk with the customers about our solutions, because what we do is basically we screen the documentation, we create like a suspicious cases for them, and then they work with this and validate it basically. But it saves them so much time of the like a tedious manual work, that they can then focus on talking to people in the departments and doing the communication and setting up the preventive measures. So this is something that computer cannot do, understanding people and negotiating with them what they should do or they shouldn't do. So I think you're totally right. It's like the communication is a thing that is, I can't see the computer would handle it.
I would take it a step further. I mean, even if a computer could do it, I don't want it. So at the end of the day, I want to negotiate with real life people and not with a database. Putting it in an example, I mean, you mentioned the time. So I heard from a physician once, when he dedicates 1 hour to a patient, 50 minutes is about documentation, is about bureaucracy, is about running through the processes, and 10 minutes is for the patients. So I think your solution, I mean, when you can take away these 50 minutes from physicians that they need to dedicate just for filling the system with information, and you can automate that and give back the 50 minutes to the physician, and the interaction between physician and patients, I think the outcome would be much better. It would be much more beneficial for patients.
Yeah, the administrative burden is really, I don't know which adjective I should use right now. Like it's really big. So like it's about the processes and how to think what we need to document, what we don't need to document. And then how to improve the process, like the dictation can speed up things and so on, and having some specialized workforce that then even only checks that if it's correct. transcription. Or you can use also the patients while they're in the waiting room to pre-fill the stuff for you. It's another thing that could be done effectively, and so on and so on. But I think like the mundane tasks should be removed from the physician's time as much as possible, because the resources are getting really scarce. You know, I don't know what about in Austria, but I think everywhere the number of physicians and nurses and everything is lower and lower, with the population getting older and older, which creates like a disbalance between the demand and what's available on the market.
I always think it's a pity to use qualified personnel for administrative tasks. When I go to my dentist, for example, I mean, it's really a great clinic, but I don't understand why in 2022 I still need to line up for check-in when I have my Apple Watch, when I have my health data on the watch, and when there's so many. I mean, in other shops, I can automatically check in just with the watch and check out with the watch. This is just one idea. Let's talk about your solution. You call your technology Heidi, which makes me always smile because it reminds me of a series that was very popular when I was a child in the 70s and 80s. And where in the complex healthcare ecosystem do you position your solution?
So Heidi, yes, it's a twist on a German name. You're right. It's kind of an abbreviation of healthcare associated infections discovery. So it also says kind of where it is positioned. It's for infection prevention teams in hospitals, which are usually formed from hospital hygiene staff and epidemiologists, basically. And it helps hospitals to automate a surveillance of these healthcare associated infections, which means infections that you acquire while you're in the hospital. So this is something that should not happen, but it affects about 5 to 10% of all inpatients in hospitals. So in Europe, it's about more than 4 million affected patients every year. So it's a really high number, and it's one of the leading adverse events in healthcare delivery worldwide, basically. And this is something that hospitals try to avoid. You know, you don't want to create, you don't want your patient to get infection after surgery in your hospital. So you try to set up preventive measures effectively as you can, but basically usually on general recommendations. So there are some best practices that you should follow. And this is something that the infection prevention teams create. And then they try to monitor the number of infections in their hospital. And they do it by going through the patient charts manually, microbiology results or something, and writing down the names and types of infections, etc. Sometimes they have some tools to help them a bit, but it's not really something that you could do in I don't know, 2-3 minutes a day. So they spend hours a day on just getting the data about these infections. And what Heidi does is that it automates a lot of these tasks. So it goes through all information from hospital information systems, like the clinical information, what physicians and nurses type into the system, as we already spoke, from the medical history, current status, like the daily progress notes, X-ray descriptions, etc. And it tries and it identifies potential cases of these healthcare associated infections by doing advanced data analysis tasks like natural language processing, extracting information out of unstructured clinical notes, and creating a comprehensive view of a patient with all these extracted information, and then suggesting the infection prevention teams, like, hey, here is a potential case of HAI. Just look at this data that we present you and check if it's really this case or not. And they can do this very quickly in 2-3 minutes per case, and then having all the rest of the time for setting up the preventive measures. Because so this is something what Heidi does in a first step. It helps hospitals to monitor the states of HAIs in their hospital. And once they know the state, it also helps them to look for the root causes, why it happened. So it also analyzes the previous steps in treatment and pick up the risky ones. So the steps that create higher probability of acquiring this kind of infection. So it helps further the hospitals to decrease, to target the preventive measures effectively, and then ultimately decrease the number of healthcare associated infections in their facility.
I mean, the ideal world, I can imagine the ideal world. So you have a warning system, a dashboard, where you get a signal when a new infection enters your hospital system. And then digital assistant pops up, a hologram, and explains exactly how it happened, when it entered, how it spread in the hospital, and the 5 steps you need to do to contain it. And everything is based on data. So what's the reality currently? What does it mean for a company? Where does the data come from? Do you base your solution on the existing data, or do you need additional forms to be filled in?
So we are working with the existing data. No additional forms have to be filled in. So it automatically reads. So there needs to be an interface between the hospital information system and Heidi set up, and then it automatically analyzes on a continuous basis all the data that the physicians type in. So once a physician comes to your bed and sees like you have fever and additional pain and so on and so on. So he sits at the computer, types in this information, then it's saved into the system and we analyze it. Heidi automatically realizes there is a new information about the fever, there is like some new pain in stomach or whatever, and adds it to the model of the patient, like to the information that were previously available and so on. And to the first thing, like about monitoring the infection. So we have to distinguish between the infection that is called a community acquired infection. So the one that you come with to the hospital, which is not healthcare or hospital acquired. So you can track also the infection that comes into your hospital, but then it's not this secondary infection that you get in the hospital, basically, which you cannot prevent what the people bring from outside. It's a lottery.
So it's a great surveillance system. What the hospital needs to do, though, is having some sort of digital system already implemented.
Yes,
and
you need electronic health records, at least partial electronic health records, to be able to use basically any solution that would work with this kind of data. But for Heidi, it's you need like the state of the patient when it enters the hospital to exclude the states of the patient when they were admitted. So it's one thing, and the other thing is like some kind of progress during the hospitalization to track the state of the patient.
So when this database already exists, then you plug in Heidi, your solution.
Yes.
Heidi extracts the data from the existing data, whatever these databases are, and analyzes the data flow in real time.
Exactly.
And then you have a feedback loop. So when Heidi detects a signal where you say, okay, there is something going on in the hospital.
Yeah, so we have a user interface for the users where they can see all this information structured in a nice way, which is also which also receives a positive feedback that it looks like really intuitive and easy to use. Because we know that the people from hospitals are not ID specialists and want to have some nice interfaces as well.
So it's not like the Matrix that some numbers are just
no. It's like a usual web application that you're using for, I don't know, like with left menu and some stuff about the patient and so on. So then they work with this.
So it's an automated surveillance system for the hospital that the management can implement and doesn't create additional work for the team. How is the signaling processes? How are they set up? Is it automated to decision makers get an email, or how do you handle the warning signal?
So as I said, the team has to either confirm or reject the case. So once this is done, they usually the flow is usually in a way that this team creates outputs or informs other stakeholders. So once they have like a period of time finished, or once they have like cases validated, they inform the other personnel. For example, like in some hospitals where I think it's a really great practice, like they validate these cases on an ongoing basis. Do not wait like months. It's not a good practice to wait too long, and they can react quickly when the patient is still in the hospital. So when there is a severe case or something, they can inform the physician, check what's going on, ask what really happened before that, and they can, create some additional preventive measures to avoid this kind of cases in the future.
That sounds great. And you mentioned, so it's not, I mean, it's for hospital-acquired infections. And we talked briefly about community-acquired infections. I mean, this was very popular in the last 3 years, and a lot of innovation happened in this area. Would it also be possible to use your solution for monitoring entire regions, and just thinking about when you can plug in every hospital in a region? Would it also be possible to use your solution for large-scale surveillance?
Yeah, it could be possible if you connect, but it has to be connected to like multiple sources, and then the interoperability comes into play basically. So one thing is hospitals, but there are also outpatient clinics who handle like mild infections, I would say. You don't go with a basic urinary tract infection. You don't end up in a hospital. So there's a lot of like GPs also handle some infections and so on. So then you would have to connect like a lot of practices and clinics into the system to be able. But in general, yes. For example, one thing that we also work with is antibiotic resistance and antimicrobial resistance. So we analyze microbiology results that are only in textual form very often in the systems, and help hospitals to see the resistance patterns of specific pathogens. So and they usually test it in hospitals, not often in an outpatient setting. So we could also help to monitor like a nationwide situation of this resistance, because this is something that hospitals really appreciate to have in one click to see what's really happened, and the patterns really change from region to region, which was kind of surprising for me.
That's great. Let's talk in the last part of the podcast recording. Let's talk a little bit about your company, the founding process, and where you stand currently in terms of financing and funding. How was it to found a company in Prague?
Yeah, that's a good question. So as I said, we started with like a general natural language processing, data analytics company providing services to different kinds of industries, utility, insurance, banking, then ended up in healthcare basically. I think like in Prague, there is a great environment of smart people coming from universities. Like I think there is a like great history in teaching and producing high quality engineers and computer scientists, mathematicians in general. So there is a lot of people that you can pick from, the talent basically. That's also why a lot of global corporations set up their R&D teams in here and try to suck out the
extract the know-how.
Yeah, exactly. To take the advantage basically of this environment. So I think this is great. You can start in Prague, or you can even start somewhere in smaller cities in Czech Republic, where a lot of innovation centers also opened thanks to European funding, and they try to really help the companies to start. I think in 2013 or 14 when we started the company, 2014 started the company officially, and we're focused on general solutions. It was not that common to have these incubators and so on, but then it started to grow. So I think the environment in Prague is still getting better and better. There's a initiative called Prague AI, PRG.ai, which brings together like universities, public offices, and also privately owned companies to create. And they say they want to make the Prague the center of AI, basically. And so we started with this, and we did this, but then ended up in healthcare with a business partner who is a major investor right now in the company as well. So yeah, I think Prague is great to start a tech startup, I would say. But it has the same obstacles as everywhere.
Yeah, Prague is a great city. I completely agree. And there are a lot of hidden gems in the city when it comes to science. Recently, I think it's I&I Bio, so fund in Prague, closed a 50 million euro funding round. So they have grown tremendously. I think I&I started back in 2016, 17. And Prague is definitely one of the evolving or fastest evolving ecosystems, in my opinion, in Europe, and a beautiful city to be in. Where do you see your company in the future?
So we have implemented the solution in many hospitals right now in Czech Republic. And we see that we need to grow abroad. So we have already implemented our solution also in Slovakia and Austria, and want to grow further in Austria and Germany as well, because the market potential is much greater in Czech Republic. I think in Czech Republic it's around 100 hospitals maximum, target hospitals that might use ID, for example. So this is one thing. I think like the situation in hospitals in Germany and Austria is quite similar to Czech hospitals as we observe. So there's a great potential to help them with leveraging the power of data in this. And as we already spoke as well, is creating more products based on a similar idea of helping hospitals to monitor clinical risks and helping them to mitigate it and create or provide safer and better care to patients. So we are now working on more solutions targeted at clinical pharmacists, basically. So medication safety and helping hospitals to not create that much antimicrobial resistance, etc. So this is another thing that we're working with, and that would be based on the similar, I would say, similar approach as Heidi.
What are your three preferred or perfect partners that you would love to find in 2023 that help you move your company forward?
Three ideal partners. That's a great thing. So I would say in general, for us, it's important to partner or create solution or find solutions with the information system vendors. So because we have to connect to the information systems, and sometimes it's not that easy because the systems have grown over the years and so on. So we're looking for, we've done this in Czech Republic and with like a major vendor of hospital information system, so it can be done, and we are working on this to create partnerships in Germany and Austria as well. So this would be like a first area of partners. Then there are people or providers of solutions that might be complementary to ours, so like consulting services or even material to hospitals that might help the data analytics to help them in their proof that it works, really what they're saying, and so on. This is like being our partner for delivery of the solutions. And ultimately, of course, we're looking for customers, which is like the best thing to do, and finding a group of hospitals that would be able to use it like in multiple instances or for multiple places, and that always helps them to see what's happening in different locations and use the best practices from each of them to move the standards really to the top level of all the hospitals. That's also great, because we've seen this in Czech Republic, working with also smaller hospitals, also with larger group. This is something that we would love to do in 2023, especially in Germany, for finding this kind of partner.
That's great. And do you also have room for investment capital, or are you one of those companies who are self-sufficient and don't need outside investors?
Yes, that would be the fourth partner, basically.
Okay, I said only three.
Yeah, sorry.
My fault.
That would be like a fourth, because these ones were what I mentioned, like first time would be like a final consumers for partners for like a direct sales or implementation. For us right now, we see a room for speeding up the expansion and in both directions, geographically and product wise. So we're now preparing our company for raising more investments from external partners that would bring not only the money but also the knowledge of the specific healthcare environment, for example, in Germany or DACH region in general, which is our target market for the next 2-3 years, basically, like T1. So yeah.
Did you already tie down the metrics, the investment metrics for the fundraising, or is it too early to talk about it?
I think we're now preparing it, so I don't want to disclose any inaccurate numbers or something that
so it's basically on request.
Create a lot of hassle. Yeah, as I said, like we have to do all the stuff that's necessary before this to have like good estimation of what we will need in the next 24 months, something like this. Because the situation, as you might know from like companies, it's changing all the time.
That's true.
So you might hit a great customer, or you just don't. So you have to adapt quickly. So that's what we're doing.
That's true.
But
that's
but
true.
we'll start looking soon. So in I would say in a couple of weeks.
So okay, that's good to know. Before I ask my final question, is there any topic open that you would like to talk about in this episode?
I think we've covered a lot of the topics that are important, like about the value of data in healthcare. I think it's a topic that should be discussed more often. And
true.
About the resources in IT. I see in hospitals, I can't say in Austria, for example, how it is, if it's the same like here, but the resources in IT are really scarce. And I would say like that the hospitals should realize the potential and invest more, and it should have a clear, from my point of view, there has to be a clear business case and why they should do it, and with all the stuff that they are required to do with all the cybersecurity and data protection and everything, having like, I don't know, 3-4 people in IT department is really a low number.
Yeah, that's true. I think this is historically still a problem. I think before 1970, no IT department was needed. Then it was just the only work they had to do is just setting up a few computers in a hospital. And now the world is moving in a completely new direction with data analytics. A lot of more data is coming in, and also the need for having more personnel in all companies, not only the healthcare system.
Yeah, and the people are used to working with the different tools and gadgets and so on, and the systems are not really prepared for this. Like, so it's great challenge to use it and to take the advantage of all the innovation.
Jakub, it's a pleasure talking to you, and I think we could spend easily another 1 or 2 hours on the topic of data analytics. There are a lot of questions in my mind that are still open. My last question to you is, when someone of your 4 preferred parties listens to the podcast episode or to the live stream on LinkedIn, what's the best way to reach out to you?
I think the easiest way is to find me on LinkedIn, where they can send me a message or connect with me, or they can drop me an email on I don't know if I should spell it, jakub.kozak@datlowe.cz. They can also find me on our website, www.datlowe.com. I'm there somewhere with my LinkedIn profile hidden as well, and on the team page.
Super. I will put your contact data in the description of the podcast and also description of the live stream. And I encourage everybody who's listening and wants to connect with Jakub to just reach out. Thank you very much for your time and giving excellent insight into data analytics. I wish you and your team good luck for the future, and let's catch up soon.
Thank you for the invitation. It was my pleasure talking with you, Christian.
Have a great day. Bye.
Have a nice day. Bye-bye.